I've been qualified 15 years and have specialised very early in rehabilitation of any injuries, orthopaedic, muscular, and have been a physio manager at a hospital, gained a lot of experience, worked closely with consultants and GPs, and now run my own practice. I have had a lot of hand experience in my training, in that I worked in South Africa on mining hospitals, and most of the injuries are crush injuries of the hand. This is more appropriate for early rehabilitations following an injury. It could also be applied to children, or in those in the sporting population who aren't as strong, or arthritic hands. It comes with a pink ball, so easier to squash, and then it comes with a pink and a yellow band, and both of these are a lot easier to pull apart. This pack, which includes the blue ball and the blue and green bands, is more appropriate for the sporting population or final rehabilitation of patients, because it requires stronger resistance to either squash the ball or open the band. Thumb extension is movement of the thumb away from the palm. So how we apply that, we put the band around the fingers, put the thumb through one of the holes, and then open the thumb away from the palm. This is particularly useful with tenosynovitis of the thumb, arthritis of the thumb, and just generally in most hand injuries. Wrist extension is the ability of the wrist to bend backwards, and how we apply that to the band is we slide one hand through the band, the other hand underneath, and then we will bend the wrist backwards against the band. This is particularly useful for injuries like tennis elbow. Finger extension is the ability of the fingers to bend backwards at that joint. So there are two different ways we can do this. We put each individual finger through the band and then extend the fingers. And that is working the thumb as well. If we want to take the thumb out of it for whatever reason, if it's injured, or make the exercise a little bit harder, what we can do is slip our other hand through, holding the band, and then extend the fingers like that. So the next important grip is called the key grip, which is that movement there, which is very functional in most applications that you do every day. We put the ball again in between the index finger and the thumb, and then we squeeze it like that, trying to keep your fingers straight. This is a functional grip because once you lose strength in any part of your hand, you lose the ability to do these grips. The pincer grip is that grip, again, gives us a lot of dexterity. So how we go about strengthening that is we put the ball between the fingers and squeeze, and obviously we move it along the hand, doing each finger individually. The power grip is the grip we all do hundreds of times a day and know, and how we apply that is we put the ball into our hand and then squeeze it as hard as we can. We can incorporate the thumb as well if we want, but we can also just use our fingers. Once we've strengthened the individual muscles, we can combine the products and strengthen the hand more functionally. So we put the ball in and have the band around the fingers. We squeeze the ball, straighten out the fingers. That is generally good for functional hand strength, so incorporating all those individual muscles that we strengthened before. Having them together means you can work both flexion and extension of the hand and all the other associated movements that you require, which is what gives us the dexterity. So having the two together is fantastic because you can send someone away working both elements. The main thing with exercise is you need to do it constantly through the day. And the nice thing with a hand trainer, it's quite easy to take it with you. Considering all the things it can achieve, it would really make sense to most people who have a hand injury to purchase one because they will really see the benefits after using the product for a few weeks.